My name is Kim Linloff. I'm the President and CEO of the Mid-Maine Chamber of Commerce, and I want to welcome you here today. Nearly a year into the global COVID-19 pandemic, we're still dealing with the heavy toll of the virus on all aspects of our lives, from family, school, activities, and our general economy. All of us want to move on and get back to the lives we love and to see our communities thrive. Today, we're pleased to host this forum with 3 representatives from healthcare in the Kennebec Valley. Today's forum is hosted by a number of community organizations, including the Mid-Maine Chamber of Commerce, KV Connect, which is the area's young professional group, Central Maine Growth Council, Kennebec Valley Council of Governments, and the Alphon Youth and Community Center. Our healthcare experts today are generously giving their time and expertise to provide an overview of where we are now in the pandemic, what hope is on the horizon, and steps each of us can take to get beyond this challenging time. So at this time, I'd like to welcome our panel. Today we're featuring Dr. Steve Diaz, who's the Chief Medical Officer for MaineGeneral Health. Dr. James Jarvis is the Physician Leader, Incident Command, Northern Light Health, as well as Lisa Landry, Esquire. She is the HR Director for Redington-Fairview General Hospital, which is located in Skowhegan. They're going to cover some basic topics first, and then we will open up the floor to ask you questions of our 3 panelists. There's a lot of ground to cover, and we have 1 hour. So I'll ask that as you have questions, if you could please enter those in the chat box below, and we'll get to as many of them as we can during the briefing. If we don't get to all of them, we'll follow up with the appropriate panelists and try to get the answers that you seek. Our first topic, well, let me run through the 3 topics. First, who's going to present is Dr. Diaz. He's going to talk about the rate of transmission, testing, hospitalization, and what everyone can do to stay as safe as possible. Next, we're going to move on to other trends presented by Dr. Jarvis, new strains and what that means, how hospitals have responded, including safety protocols, expanding healthcare, telehealth options. And then we're going to move on to Lisa Landry from Redington-Fairview, who's going to speak on things around employment. In terms of employment-related issues, briefly discussing health screenings of employees, mandating vaccination, incentives for vaccination, accommodations, and policies and practices post-vaccination. Also, our speakers are going to touch on who's eligible to receive the vaccine now, where can they get vaccinated, what is the process to register. Each will provide an update from their perspectives. All 3 speakers are going to talk about scams and hopefully say the same thing, and emphasize what to look for and what to avoid with people saying about that you need to pay for the vaccine and whatnot. So with that, I'm going to ask Steve Diaz, Dr. Diaz, to please kick this off. Again, he's going to talk about rate of transmission, testing, hospitalization, and what everyone can do to stay safe as possible. Dr. Diaz?
Thank you, Kim. My name is Steve Diaz. As Kim said, I'm the Chief Medical Officer for MaineGeneral Health. I came to Maine 28 years ago for 3 years to train at the FMI in Augusta, and I've stayed with MaineGeneral for the last 25 years. My background is in emergency medicine, disaster medicine, and emergency medical services. I'm actually the past Chief Medical Officer for the DMAT team, Disaster Medical Assistance Team, the Federal Resource out of New Hampshire, and I'm still the State Chief Medical Officer for Maine Task Force 1. So if anybody wants to take that role, that'd be great. I'm very fortunate to be here. My wife, Tammy, and I, she's the school nurse for Winslow Junior High, have 5 children, and we live in Waterville. And so it's near and dear to my heart that Kennebec County get this right. So what's going on in Kennebec County? And actually, there's a number they use called the case rate over 14 days or 28 days, but the case rate over 14 days tells you how many people per 10,000 have COVID. And Kennebec County has a pretty good number right now at 19.62. The problem is that is still a high number. Now, back in early January, that number was around 80. A low case rate is 8 and below. Moderate is 9 to 16. So we're still in the high community transmission. You can also look at other numbers like the positivity rate, and it's pretty low in Maine, about 1%. The problem is that you need to look at all the numbers to know how we're doing. So we're doing better now than we were in January. But if we were to see the numbers we have now in October, we'd be a little mortified because they're much higher than they were for the summer. Maine did a really good job in the summer not having the spread of COVID. When you look at hospitalizations, that has also gone down the last couple of weeks. That's all great. January, again, from the holidays, had a very high hospital census for COVID. And again, the case rate and the positive percentage rate was really high. I think the things that have made a difference, though, by and large, have to do with testing and the things we do as behaviors to help stem COVID. So testing has really expanded across the state. If you have symptoms, testing through either your PCP or a pharmacy or a hospital is available, and that is a great way to make sure you don't spread if you do have COVID. If you don't have symptoms, but you need to be screened for it, there are swab and send sites all around the state, and I know all the 3 systems represented here today all do swab and send that allow people who are asymptomatic to get tested. The state has a testing site by zip code. It's gettestedcovid19.org, and the state's done a great job of keeping their online resources updated. So despite the good news, though, we're not out of the woods. People ask me all the time, when do you think things might relax a little bit? And my answer, which is really aspirational, would be this fall. If everything goes swimmingly, maybe this fall, we might get a little bit of a break. And I said that, I've been saying that for a month now. Of course, Dr. Fauci has now said that he hopes by 2022, we have some reprieve, and he's the smartest doctor, I think. And actually I met him once. He is when I graduated from med school, he was our commencement speaker. So if I had known what a great person he would be, I would have given my card then. But I shook his hand, and he really is the bellwether for what might happen, but I'm still hoping the fall. Saying that then means that what do we do to stay safe? And the number one thing that has made a huge difference is if you're ill, stay home. If you have cold symptoms or flu symptoms, you're not feeling well, the idea of sucking it up and going in really is not a good strategy. It's never been a good strategy, but it really is not good now. And actually, if you look at the flu numbers in Maine, they're so terrific this year because everything we've done to help mitigate the spread of COVID obviously impacts the flu. So we're doing great. And you all know the different things we should do. Mask, stay 6 feet away from people, wash your hands, stay home if you're ill, and then trying to encourage those around us to do the same. The idea of how infectious is COVID is actually scientifically quite interesting. There's a number called, it's R with that weird 0 with a slasher, it's called R naught. An R naught of 1 means that if you have an illness, you're going to pass it to one person on a daily rate. That's, that's straight across the board. Influenza is using R naught 1.8 to 2.3. COVID has had an R naught above 3. And the thing that's interesting is right now nationally, the R naught for COVID is 0.7. It's less than 1. It's a very peculiar virus. And so when you talk about how infective it is, it's a little bit all over the map. And I think part of the reason it's all over the map is that the behavioral health strategies, that is the behavioral ideas of staying away from people, washing your hands and masking has made a difference. And because not everyone's doing it, it bounces all over the place. So to answer Kim's question of me, it's very effective at times, although right now it's not bad. Our rates are going down, hospitalizations are going down. We're getting vaccine out there that we'll talk about later. But really, we have to hold the course on masking, social distancing, and washing our hands. And with that, I'll pass it back to Kim.
Thank you, Steve. Next, we're going to pitch it over to Dr. Jarvis. Dr. Jarvis is going to talk about other trends, new strains and what that means, how hospitals have responded, including safety protocols, and expanding telehealth options. Dr. Jarvis?
Well, thank you for that. So I'm a family physician by training. I did train in the United States Air Force, where I did serve as a triage officer. And so dealing with unusual and catastrophic events was part of my background in training. And I did complete a course in biological warfare. Really, I think it's what prepared me to do what we've been doing for the last year in terms of response to this pandemic. Um, so things that are trending right now, I think variants is a key one for us to be focused in on. So coronaviruses are notorious to change. They don't change as quickly as we see with influenza virus, and one of the reasons why we need to get a different flu shot each year is because the influenza virus changes in a way that makes it so that we don't get lifelong protection against it. With coronaviruses, they've always been kind of tricky for human beings. We all get infected with coronaviruses each year. It's one of the major causes of the common cold, and yet none of us get lifelong protection. And so when we have a coronavirus that becomes as lethal as this one, that's where our major concern is, because we just don't build that lifelong immunity. So the prevailing strain over most of the past year has been one that, as we all know, has caused severe disease in certain individuals and certainly contributed to an increase in the death rate here in the United States. But two new variants that are now starting to creep up are concerning. The first is the one that we talk about the most, which is the B117 variant, and that's the one that was first identified in the United Kingdom. And that one's concerning because it's more infectious than the predominant strain we've seen over the past year, meaning that as Dr. Diaz talked about, that R naught, how many people can you infect when you're infected, is higher with that particular strain. The good news is it's not any more virulent, meaning that it doesn't cause any more severe death or mortality than the strain we were dealing with. But if more people become infected with it, we'll have more people who have severe illness and more death. The other strains that we're worried about is the one that was first detected in South Africa and the one that was first detected in Brazil. And both of them are more virulent, so they do cause more severe disease. Thankfully, in the United States so far, they have not started to take hold like we're seeing with that UK variant. Some of the predictive models say that the UK variant, or that B117, will become the dominant strain in the United States sometime during the spring. And if that's the case, we will start to see numbers climb. As Dr. Diaz mentioned, we look at our rates right now and we're very happy with them because we're comparing them to a month ago when we saw that hospitalizations across the state were increased and the number of people that were dying from the disease in the state of Maine were increased. But we have to remember, if we saw these same numbers back in the early part of the fall, we would have been alarmed by these numbers. So this is not a time for us to let our guard down. We need to continue practicing all of those good safety strategies. So as far as what our healthcare systems have been doing in response to the new variants, the good news is we haven't been doing much. And I say that because that means we've done such a tremendous job protecting our healthcare workers, our patients, and those who come in and out of our hospitals, like our visitors and other personnel that we depend on to be able to keep our hospitals and our clinics open. We've been able to protect all of them so well that we don't feel that any of these new variants add any particular need for us to change our course. What you'll see is that you'll continue to hear us say, you must be masked when you come into our facilities. We will continue to have strict visitation requirements now. Almost all of the health systems now only allow one visitor per patient, and sometimes that's one visitor per patient for the entire patient stay, meaning that on that first visit to the hospital, whether that's through the emergency room or just a direct admission, you need to identify who the person is that's going to be your support person for the rest of your stay. And we do that because we need to limit the number of people going in and out of all of our facilities, because it's all about viral load. How much virus do we see coming in and out of our community, and when we can limit that. So you won't see any differences there. If you remember, about a year ago, we started to talk about curtailing or delaying elective surgeries and other elective and preventative health services. We no longer recommend that because we have done such a good job in making sure that when we all wear our personal protective equipment, we all remain 6 feet apart, and we limit the number of people going in and out of our facilities, it is perfectly safe for us to continue doing elective surgeries, elective procedures, and then those all too important preventative medicine services. What we feel we're going to find is that there is going to be a hidden death rate to COVID-19 because we did have delay in diagnosis due to putting off preventative care services. So now we're really encouraging people that we need to catch back up again. We need to get our colonoscopies done, our mammograms done, our pap smears done, and the like, in order to detect cancers and other diseases at an earlier rate, so that we can help prevent people from having severe disease or even death from those. And so that's the double whammy of COVID. It in and of itself is a deadly disease, and yet it caused us to actually have other diseases that went uncontrolled for a period of time. And but now, again, it is very safe to enter into our facilities. We see almost no spread of disease within our facilities. Almost all spread of disease now is happening out in the communities. And even in long-term care facilities where we had seen spread of disease in the initial part of the pandemic, and in fact, in the state of Maine, that's where almost all of our disease was. We're not seeing that anymore. In fact, today I was just on a call where for First Atlantic, which is one of our largest long-term care facilities across the state, they have 0 cases of COVID in any of their facilities now. That's a remarkable achievement for us. So the disease that we're talking about now is the disease that's out in our communities, and so that's just another word of caution. One other thing that most of our health systems have embraced is telehealth. And what has telehealth helped us in this endeavor is because it allows us to communicate with our patients without having that face-to-face contact where it puts people at risk. It allows us then to have more support people, right? So you can be in your home with telehealth, and if you wanted to have your sister and your brother, or your mother and your father, or someone else in the room hearing the kind of questions that the physician raises or that you raise with your provider, that can be done. It's also kind of been an interesting thing for us as on the other side as providers. It gives us a window into your home life, something that we just have not done. Maybe Dr. Diaz is a little different, but for myself and my training did not include a lot of home visits. We didn't do house calls for the longest time. Well, telehealth is the house calls of the future. It allows us to see what your home looks like. It allows us to ask particular questions that sometimes cannot be answered in an office space, like, what is the food source in your refrigerator and in your kitchen cabinets? Is this something that we can help you to address so that you can get your chronic disease management under control? We've had a lot of people be concerned, well, how can you do a physical exam when you're not in the same room with somebody? Well, right now, Dr. Diaz and myself are doing physical exams on each and every one of you just because it's part of our nature to observe people. And we can learn a lot just from observing. We can also use technology to improve upon our abilities to actually provide healthcare. So we have the ability now to actually have monitoring devices in your own home to take your blood pressure, your temperature, your heart rate, your pulse oximetry, your weight, and give those information back to us to be able to then do some of the same things that we would do in our office. And then we have other techniques that we can do to kind of tease that out. One of the great advantages that we've seen in this is being able to reach out to those who suffer from mental illness. We know that it's hard for them right now to get out of their homes. It's hard for them to travel, and yet that just makes their underlying condition even worse. And so telehealth has been embraced by the mental health community and the behavioral health community, and has really done wonders in reaching out. And with that, I'll turn it back to Kim.
Thank you, Dr. Jarvis. Next, I would like to introduce Lisa Landry. Lisa comes at this from a little bit different perspective in that she's a human resource professional with Redington-Fairview Hospital. So in terms of employment-related issues, she's going to briefly discuss health screenings of employees, mandating vaccination, incentives for vaccination, accommodations, and policies and practices post-vaccination. Lisa?
All right. Thank you, Kim. Good morning, everybody. As Kim said, I'm Lisa Landry. I'm the HR Director at Redington-Fairview General Hospital here in Skowhegan. My background is in the law. I'm still a licensed attorney, but am recovering from private practice, as lawyers say. So been here about 6 years and grew up in the Skowhegan area, went away for school, and have come back to raise a family. So like Dr. Diaz and Dr. Jarvis, really invested in this area and keeping our communities safe. So I'm going to touch on some employment related subjects that hopefully will be of interest to you as employers and or employees. And certainly I'm open to questions at the end as Kim has talked about. So OSHA has released many times guidance for employers on what they should be doing in their workplaces. And specific to COVID-19, they recommend that employers take an active approach to it and implement prevention programs right there in their workplaces. And so there's many ways to look at that and many different measures that people can take in their workplaces. Masking, distancing, hand hygienes, I think are really the core, the basics that here in healthcare we really promote as well. And then there's health screening, which at this point, hopefully many of you are doing your health screening, your employees that are coming in prior to working. And now we have vaccines. And so that could be another measure that you take on and really promote within your staff. In terms of health screening your employees, you can do it. The EEOC, which is the Equal Employment Opportunity Group, they have said you can do it. OSHA thinks that you'd have a general duty to protect employees from hazards. I would agree, of course. And certainly COVID is one of those hazards. So screening can be part of doing that. You can do it a number of different ways. We saw over the course of this past year, apps come out with new ways to screen employees. We actually use one here. And that can be very helpful and a streamlined tool for you to use to track whether people are experiencing symptoms or have had exposures that would be concerning, or maybe you want to keep them out of the workplace because they are direct contacts. I will note that if you have any documentation of health screening that your employees have filled out, those do have to be treated as private medical records. So you need to handle those with care, keep them confidential, just like if you worked here in a healthcare facility, HIPAA applies. So also you want to look at what policies you have in place if somebody does have symptoms or they have been exposed. As an employer, from an employment perspective, you want to make sure that those policies are fair to your employees and of course are even across the board. So there aren't exceptions being made for certain employees versus others. So that's all I'm going to say on health screening in the interest of time, because it's more straightforward than the vaccination piece. Vaccines they can implicate a number of different laws that we have here in place, primarily federal laws. The Americans with Disabilities Act is kind of the big one. In general, that's something employers should be aware of, where if an employee does have a disability and they ask for an accommodation in the workplace, the employer needs to respond to that. And there's a specific process employers should go through. It's an interactive process. There are conversations directly with the employee back and forth, and COVID applies. So we've seen in our workplace, particularly when working with patients, there are individuals that have high risk health conditions that put them at higher risk than their peers for COVID-19. And so really in any workplace, you probably have at least one of those employees that may have a high risk condition that you should work with to try to keep them safe. Workplace accommodations can look like a lot of different things. You can be creative. Again, this is part of that interactive conversation that you have with staff to discuss what can we do to keep you working and keep you safe while doing so. And so that may be different hours that they have, maybe when there are fewer people around. Remote work has become very popular. I see a lot of you are probably working from home here on the Zoom. And it may be even a different job. If you have another position open that's available and they are qualified for, you might move them into that position if there's going to be less contact with others. So workplace accommodations has been a big challenge, I think, for employers over this past year in trying to keep people safe, of course, and keep them employed. A resource I want to mention for employers that you can always go to is the Job Accommodation Network, JAN. So you can, if you Google that, you can find some great resources in terms of the disability laws. So moving towards vaccines, and looking for employees to get vaccinated, of course, the general public. We also have to take into consideration the ADA and what accommodations you may have to make for employees if they aren't able to get the vaccine for health reasons. Or they may also have a religious belief that opposes vaccination. So very similar to the disabilities law, you have to go through an interactive process for religious accommodations as well. I'd also like to note that disability can include pregnancy. So I'm sure Dr. Jarvis and Dr. Diaz can speak to this better than I can. The CDC doesn't say that you shouldn't get it, but they do advise you to talk with your OB provider about getting the vaccine. And we have certainly had some employees here who are pregnant and just are not ready to get that vaccine, or they've consulted with their provider and don't feel they should at this time. So again, with vaccines, you may have to look at those accommodations, restructuring a work area or a schedule or something like that if you're looking for employees to get vaccinated and you have individuals that can't because of medical or religious reasons. So that brings me into mandating vaccination. Can you do it? The short answer is yes. Should you do it? The short answer is maybe not. We really want to strongly encourage people to get vaccinated. We, of course, feel it's very important from a public health and healthcare point of view, but it's very tricky legally when you start mandating vaccines. And so that can implicate the ADA, like we've talked about. It can implicate the Pregnancy Discrimination Act, Title VII of the Civil Rights Act, which prevents discrimination in the workplace. And so you want to be a little careful if you decide to mandate vaccination for your employees. Again, we have the accommodations, and then you have to decide what you do for people that maybe don't have a medical reason or a religious reason, but simply refuse to be vaccinated. What are you going to do with those staff members? It could be somebody you don't expect, could be a very high value employee for your organization. And again, you have to be fair across the board so that you don't get into any discrimination issues. The other thing you want to do is try to keep morale up. It's a pandemic. We've been going for a long time. As Dr. Diaz mentioned, it could be the fall or even 2022 before we have we reach the light at the end of the tunnel. Vaccine for us has been kind of the light at the end of the tunnel, like it's coming. But keeping morale up is really important during these times. And with the new vaccine that has been under emergency use authorization, you get lots of strong opinions out there on vaccine in general, I think, but also with COVID being so new and concern over any reactions that people may have. So that fear of the unknown really can affect your workplace morale. And that can be a huge, huge factor in whether or not you want to really push for mandating vaccination. There are some employers that have offered incentives to vaccinate, and this is a legal gray area at this point. There's really no legal precedent on this specifically. We do know that there are regulations around wellness plans and wellness incentive programs that really limit the amount or size of incentives you can give employees in order for them to participate in it. Employers need to make sure that it's a de minimis incentive so that it's not so coercive. It's not such a huge incentive that other people feel like they really have to do it in order to get it. But given the uncertainty, it's probably best not to do cash incentives for vaccination. Some examples that may work well would be time off in order to get vaccinated. Maybe you allow for absences in your attendance policy for people to take time during their regular day to go get vaccinated, or maybe you pay them for up to 2 or 4 hours of pay to get their vaccine, an amount that's reasonable for them to be able to get that over to the clinic, wherever that may be, and get vaccinated and come back. And I've also read about some employers who might allow for pay protection if an employee has a reaction to the vaccine. So those are some options to sort of incentivize your staff to get vaccinated versus mandating them to do it. And again, it's a gray area, and you get into the tricky situations if you're offering an incentive to those getting vaccinated and not to those that are not getting vaccinated for health or religious reasons. And so just finally, to wrap this up in the interest of time, what do you do once we have, vaccinations for your general employee population, the general public? What policies and procedures should you keep? And the short answer is probably most of them. The CDC really recommends that your policies and procedures around safety continue even after some or all of your employees are vaccinated, because as we know, there are variants, which we've talked about here today. There is still some risk of getting COVID and transmitting it if you've been vaccinated. So the CDC is really asking people to keep doing the things that they have been doing to keep themselves and others safe, both in and out of the workplace. Continue your masking, your distancing as well as you can, good hand hygiene, good cleaning in your work areas, and so forth. And that wraps it up for me, Kim, so I'll turn it back over to you. I try to fit a lot in there in a short period of time.
Can I ask you one more thing, Lisa? Can you speak to the scams that you're seeing out there? What should people avoid as far as the scams?
Yeah, we are hearing from members of the public that they are getting phone calls that look like they're coming from our hospital. I'm sure it's happening at the other hospitals as well. And the caller is asking them for personal information that we would never ask for if we were calling you to schedule an appointment. So we will never ask you for a credit card number. We will never ask you for your social security number. If you've pre-registered with us, and I know we're going to talk about how you register to get the vaccine, then we have some of your basic information and really don't need any more information in order to schedule you for an actual appointment. So, so answer the calls, because it could be us and you don't want to miss that call, but also be very keen to hearing any questions of any financial information, bank accounts. We would never ask any of those things in order to get a vaccine.
And I presume that's true for you at Northern Light, Dr. Jarvis, and Steve at MaineGeneral?
Yeah, absolutely. If you've made contact with us, we may ask for verifying information after you've made contact with us, but we would not do that on a proactive approach. And so, be very leery of anybody who asks for personal information like a credit card or a social security number for any services, but definitely for vaccine. And so I reiterate that. I will say that unfortunately, the bigger scam that we're seeing right now is people who are falsifying their date of birth in order to try to cut ahead of the line. And so I caution people about that and ask that they don't do that. So,
are you all charging for the vaccine? Like, how much does it cost?
So the vaccine itself is free because the federal government has prepaid for all the vaccine in the United States. Administration, there is a cost for that. However, we have been directed by the federal government that we cannot charge directly any individual for that cost. So if you have insurance or you have Medicare, then we would bill that insurance or the Medicare for the administration costs of the vaccine, but no out-of-pocket costs. So anybody who's being asked for out-of-pocket charges for vaccination should report that to the state, because that should not be being done.
It's the same for us here at Redington-Fairview. We are billing insurance for the administration, but if there was any costs that were not covered, we are not billing the patient directly for that. And I would echo, please report it if you do. It's an error likely, so you could also call us and we could make sure that gets written off if for some reason you were sent a bill for the vaccine administration, because we would not do that.
We're all aligned on that same answer.
Thank you. Thank you. We do have a couple of questions in the chat. I'm gonna start at the top here. Given that these new vaccines without longitudinal studies, how can the vaccine be considered safe?
So, interesting time. So vaccines are viewed through two different lenses and a third lens if you're a healthcare worker. So as everyone knows, vaccines have been around for decades, and the COVID pandemic has prompted new technology to come forth in providing vaccines. All medications, including vaccines, are a risk-benefit discussion. Is getting the disease worse than having a vaccine with side effects? First of all the vaccines in the market right now for COVID are under emergency use authorization. They're not fully approved. That actually is important to notice because, as Lisa was saying, mandating vaccinations is a bugaboo anyway. But if something's under EUA or emergency use authorizations, it's even a bigger bugaboo because it's not really approved by the FDA yet. It might get there someday, but it's not there. The EUA says that the benefit to the population outweighs holding this for final approval through all the different outcome studies. The question is, how can we be considered safe? As I said, it's a risk-benefit decision. The first lens is personal. If I get COVID, am I likely to survive, and or will I spread to my family, and will they survive? And that's a different question for everybody. So should I get vaccinated? Because the vaccine can confer some benefit, knowing there may be side effects or multiple year outcome trials that may show something different. For COVID on a personal side, and this is my personal opinion, we know that many people with COVID have long-term healthcare outcomes if they survive COVID. There's neurologic issues, there can be other issues that come up. So really on the personal side, what's the benefit to me? And I guess the younger you are, the more that decision becomes into play. But the other powerful lens of vaccinations is what you've heard called herd immunity. Actually, when H1N1 came to Maine, those of you who are here remember this, Maine was the last state to get an H1N1 epidemic back in 2009, and we had a benefit to that, and that is vaccine came to Maine prior to our epidemic with H1N1. In that scenario, we spun up a lot of clinics, especially in the schools, and we had the benefit of herd immunity in Maine at that time, and the CDC thinks it's because in Maine, we had about 80% of the school children vaccinated with vaccine, and thus we never had a big blip from H1N1. You can use the same scenario here for COVID. If we can get 60, 70, 80% of the population immunized, there's a chance that propagation of COVID will stem in a great, in a large way, thus allowing the deaths and morbidity to be greatly tamped down. So safety is really in the mind of what risk will you want to take, but there is a third lens to vaccinations for healthcare workers, and it really comes into play with COVID and influenza. In healthcare, since we care for patients, the other lens of vaccination is, do I want to be potentially the person who passes one disease to another? If we, hand washing is the biggest thing we can do to mitigate that risk, but vaccinations really do play a role for those in healthcare in helping not spread disease. So how we can consider it safe? The studies that have come out so far, although we're building the plane as we're flying it, show that there hasn't been morbidity and mortality based on that vaccine alone. But every medication, including vaccines, does have side effects. So it is a complicated answer. And we, as I say, we don't have full studies out because we've only been a year into the pandemic. And I hope that helps answer that question. And Dr.
Yeah.
Jarvis, can you add to that?
Yeah, I would just add to it that, for vaccines, almost all issues that happen with vaccines happen very relatively early after the vaccine has been administered. And one of the things that we need to remember is while these vaccines are new, we are using them at a tremendous pace. So both the Pfizer and the Moderna vaccine now have tens of millions of people who have been vaccinated. So that does give us a huge wealth of knowledge. I'll contrast that to the HPV vaccine, which we give to young individuals to help prevent both cervical cancer and some other infections. When we started giving those vaccines, within a few million doses, we realized that there was a concern about that vaccine because particularly young women of color were experiencing tremendous pain at the injection site. We found that that didn't cause any long-term issues, but we knew that very, very early. We have seen nothing like that with either the Moderna or the Pfizer vaccine, and yet we should have by now because, again, tens of millions of individuals have been vaccinated for these. So that, again, that was just a side effect, not a consequence of the vaccine itself. We should have seen some issues with the vaccines now, and we just haven't. These are incredibly safe vaccines, and the new technology that these vaccines utilize really lend themselves to being incredibly safe, which could dovetail, I think, into the next question, actually. where I see once infected and recovered from COVID, does that actually make it so the vaccines are less effective? Well, I'll give you a great example for that one too. That's the shingles vaccine. So shingles is a disease that happens after we have been infected with chickenpox as a child, and that virus is reactivated within inside our own system, defying our own immune system. And yet we have a vaccine. In fact, the shingles vaccine looks exactly like the vaccine that we use in children against chickenpox. And so we already know that, yes, being infected and then getting a vaccine actually helps to promote you having an even greater immune response. And we expect that the same thing would happen here with the COVID-19 vaccine. As I talked about a little bit earlier, coronaviruses are notorious for fooling our immune system and making it so that our immune systems do not remain immune to this coronavirus. So actually this could serve as a booster to someone who has been infected. We don't know that yet. Well, more details will come as we know more and more time has evolved, but there should be no concern about getting the vaccine after actually having had the virus in the past.
Thank you, Dr. Jarvis and Dr. Diaz. Steve, you had mentioned earlier in seeking out where you can, there was a website to go to where you can get the vaccine. I just, all the sites that are doing it. Can you rattle that off again so I can add it to the chat?
I rattled off the testing website.
That's what I meant. Thank you.
Yeah, the testing website is, I had it right here. It's HTTPS, and actually I can email it to you too, Kim, or Joy can. And it's get-tested-covid19.org. And it's a great site showing all the places you can get tested.
Get-tested-
COVID19.org. Try to put it in the chat.
Get-tested-covid.com.
Yes.
Okay. There, that was the hardest thing I've ever done. Okay. The next question I think is probably one we want to pitch over to Lisa with her law degree. Are you allowed to ask your employees if they have or will get vaccinated?
So you can. The question you'd want to ask yourself is, what is your purpose behind doing that? If it is because you want to relax some of your safety procedures, that might not be the best approach. And again, you could implicate those legal issues in terms of disabilities or medical reasons for not getting vaccinated or religious reasons, and have to go through those processes. And as I mentioned earlier, they're very specific. The law requires you to go through very specific steps in those accommodation discussions. So the better approach might be if there is somebody who is not getting vaccinated, that you just adhere to the safety practices that you have in place, make sure they are strictly adhering to those. So, I mean, I guess more or less you find out whether they're vaccinated or not, but I think everyone should continue with those practices, continuing to mask and so on and so forth.
Especially if you're a public facing business, right?
Yeah.
I mean, even if you've all been vaccinated, general public doesn't know that, so.
Exactly. So it definitely can, nobody wants to go to a grocery store or a retail store and see somebody without a mask on. And I think in general, the court of public opinion will not be kind, because they likely will not ask if the person is vaccinated. They will make their own decisions on that. And I should also mention that if you do require proof of vaccination, you have to handle those records as medical records and keep those confidential. So there's also that.
Thank you, Lisa. So Dr. Jarvis just put up the Maine.gov COVID site for where the vaccination sites are statewide, and Dr. Diaz just corrected what I mistyped as places to get tested statewide. So thank you both for that. You may want to make a note of that, to get out in your HR manuals or whatnot, your employee pay stubs. So I have another question from one of our participants. I associate pneumonia with severe COVID infections. if I have not had a pneumonia shot, does that potentially diminish the severity of COVID? If I have had, if I have had a pneumonia shot, does that potentially diminish the severity of COVID? Also, the efficacy for the Johnson & Johnson vaccine is about 66%, lower than Moderna and Pfizer. Should that be a consideration if I have a vaccine choice?
So the pneumonia shot is called Pneumovax. It's specific for what's called pneumococcus, which is a bacteria. There's many strains of pneumococcus, and so there's actually different pneumonia shots for different age groups. But no, that will not help you with COVID. It's specific to pneumococcal disease. And you should get it, by the way. If you're in the right age group to get the pneumococcal vaccine, you should get that as well. It's one of the, we highly recommend it. The J&J does have a lower efficacy for COVID than Moderna and Pfizer, but what J&J has proven, which is an outcome study, is that the J&J vaccine population-wide decreased deaths and morbidity or severity of disease using its vaccine. Now, there's lots of vaccines that are in the queue to come up for emergency use authorization. You may see that in popular press. I have no ownership of the New York Times, but the New York Times articles, their science section on COVID-related items is actually outstanding. They have the best science writers that make things digestible. So I'm saying that just in case we keep rambling and we don't get to all the questions. But I would take whatever vaccine's available given the global pandemic. The J&J vaccine will, if you were to get COVID, first of all, it's 2/3 likely to prevent you from getting the disease from a population health perspective. It may be higher if other people are also immunized. And if you do get, and actually this is true for all the vaccines, vaccines in general do not mean you can't catch the disease. The idea is that if you do get it, it helps mitigate or helps decrease the chance you will die or have severe illness. And as a community member, the more of us who are vaccinated, the more likely the virus cannot transmit. So short answer is no on the Pneumovax vaccine. Doesn't help you with COVID. And that currently all the EUAs, including J&J going up today, would be helpful in both individually and from a population health perspective, helping us with the COVID pandemic.
Dr. Diaz, you mentioned that if you're in the right age cohort, you should get the pneumonia vaccination. Am I old enough to get that yet?
Kim, at 29, you're way too young.
Thank you.
So it is age-related, and if you have other comorbid conditions for which you are at a higher risk for infections. But I'm not going to tell people that your real age. I know 29 is close, but I believe you turned 30 last year.
Yeah, that's it.
Always a politician.
Yeah, he has a future in politics. So we do have a couple of other questions. One of you or both of you mentioned side effects of the vaccine. Are there any common ones that, I know you have to hang out for like 20 minutes after you get the shot, but are there any common ones that people can anticipate or plan on getting?
Absolutely. So the reason why we ask people to wait 15 minutes and in certain cases 30 minutes is because, again, as I said, typical reactions to vaccines actually happen immediately. And so that's just making sure that you don't have an allergic reaction, which is a risk for any vaccine that we get. We kind of take a more cavalier look at influenza, but really people should be waiting 15 minutes after they get that shot as well. But the most common side effect is soreness at the injection site, which is fairly common with both of these two vaccines. Typically, it's worse after the second dose. People can have flu-like symptoms, so they'll have muscle aches, may even get a low-grade fever. And some people have reported that they have a pretty good amount of fatigue and headache after the vaccination, particularly after that second shot. And all that is related to our own immune response to the vaccine itself. And so it's actually one of those things where, yeah, I feel crappy, but I should feel good about myself because it means that it's working. Now, the caveat is not true, which is that if you don't have any symptoms at all, it means that you're not getting an immune response. That is not true at all. Anybody who's gotten the vaccine has been shown to have an immune response. And right now, we can't tell whether the people who have more side effects have a better immune response than the people who don't have any side effects at all. But we do know that side effects are directly related to the vaccine actually doing its job.
Thank you, Dr. Jarvis. I have a certain pride in our medical facilities in this area. I think you guys are all terrific and do a fantastic job. And I'm proud to have you guys here and working for the health of our communities. I think some people are blaming, maybe blaming is a too harsh a word, but it's taking a long time to get people vaccinated. It seems to be longer than what we all thought going into it. Can one of you explain why it's taking so long, that it's not you? As
It
a
really
federal
has to do
government.
with supply and demand.
Yeah.
We're delighted that there is a huge demand for this vaccine. This is a a public health event that we have not seen in our lifetime. And so we are delighted that people want to get vaccinated. The problem is it is supply. And so the Pfizer vaccine, which is actually the one that can be brought to market the quickest after it's being developed, still takes 144 days from the day that they start making the vaccine until they can ship it. So that's a long time. But in vaccine world, that's a very short time. Contrast that to the influenza vaccine, which takes almost 200 days from the time that they start cooking it up in the lab to the time that we can put it in people's arms. So that's one of our biggest issues, is really just limitation. And then it's unfortunate that here in the United States, we did not have a very logistical and logical way of distributing the vaccine across the country in both an equitable and an efficacious fashion. But we're doing that now in the state of Maine. Because of our population, we have not received dosage in the quantity that we would have liked, but we've been seeing over the last number of weeks, particularly in the last 2 weeks, that supply has increased significantly, and we welcome that. As J&J comes on board, we expect that sometime probably mid to late spring, you can define that in Maine as well, any way you like, that J&J will then be a third player for us, which will expand out how much vaccine we get. Initially, I don't expect there to be much Johnson & Johnson vaccine coming to the state of Maine, again, simply because of our population and the fact that our health systems have been fantastic at using the Pfizer vaccine, which is the more difficult logistically to utilize. We are so good at it that we have actually gotten a disproportionate amount of Pfizer vaccine in comparison to the Moderna vaccine. That's good news for Mainers because we do it well. And we know that here in Maine, we've actually done a very good job. Greater than almost 90% of any vaccine distributed to the state of Maine has been utilized in somebody's arm within a week of it arriving here. That is phenomenal rate of usage. And we've also vaccinated, I think we're now in the top 10 of states in the percentage of population has been vaccinated. And if you look at certain areas like Aroostook County, they're even better than that. So we're doing as good a job as we can with the limitations that are put in front of us. This will only get better.
So Kim, one other part, and again, not trying to throw anybody under the bus, but early on, when the federal government put out its vaccine dictums, including phase 1A, 1B, et cetera, there was a disconnect between that and what they were told that the US could expect for vaccination supply. Because of that disconnect, phase 1A grouping and phase 1B groupings were aggregated with people far greater than the vaccine supply allowed once we knew what that number was. What's another way to say it? I think if they had an accurate count of the vaccine supply chain back in October, November, when they released the national program on COVID vaccination, maybe phase 1A group would not have been all front-facing healthcare workers. Maybe phase 1B wouldn't have been age versus essential employees for whatever. So I think part of the reason we're in this confusing time right now is that the people who produced the national program had different vaccine numbers than became apparent in January when we turned on the community vaccination clinics nationwide. So again, that will sort itself out going forward. But unfortunately, what it does, it gives people information that was not as accurate as it needed to be. And thus you are on a day by day, if not week by week basis, adjusting your tiers to accommodate the supply you now have. Dr. Jarvis said it correctly in his first line, supply and demand. But part of the angst and or confusion or other emotions people are having are because we had a disconnect between the national plan and the actual vaccine stores that we had come January.
And I just want to add, if you look at the national news, the chaos that we see in lots of other states did not happen here in Maine. And that's really a direct relationship to the fact that the health systems in Maine and the state of Maine talk on a regular basis. Dr. Diaz and myself probably see each other at least 3 times a week. And so we're very coordinated in our approach to this, and we did it with a science-based, not a political-based or a fear-based model. We used science to determine how we were going to distribute, and I would say for the last month we've all been pretty much doing things very similarly, and that again has contributed to the fact that we have been able to get vaccine into individuals at a much better rate than most other states have been able to, without chaos.
And you still have capacity, correct?
We do, and so you know, right now across all of Northern Lights sites, we do have capacity, and particularly here at the Cross Insurance Center, where I apologize, I am sitting in our command center, so if you see me glancing away, it's to make sure that the line outside remains short, so there is no waiting for those who have scheduled appointments for today. But yes, we have capacity, and are happy to vaccinate whomever, whether they're a patient of ours or not.
And currently at MaineGeneral, we are at the Gussack Civic Center this week. We started going there last week for our community clinics. We are actually booked to the gills. We've had 9,250 people reach out to us for vaccines. We have 4,100 scheduled. And so, as Dr. Jarvis said, it's a week-by-week basis on our supply. So we do plan out our schedules, but it's hard. You don't want to call people back and say, we can't give it to you now. So it is a little bit of a supply and demand issue of a weekly dosing becomes hard if the supply chain is disrupted, as almost happened this week as well. So we currently don't have capacity to have people this week, but of course we are open to taking people appropriately and adding them to our list and calling them when we have the opening on the clinic.
It's the same here at Redington-Fairview. We set up an alternate site for a vaccine clinic. It's at 98 North Avenue, right here in Skowhegan. And, you know, same thing. We find out late in the week how much vaccine we're going to get for the next week, and we immediately start scheduling. So we go through that vaccine in that next week as soon as we get it. And we get a lot of calls. People are wondering, when is my turn? Where am I on the list? And I can, you know, totally relate. We all, either for ourselves or family members, really want them to get in. And we just can't answer that question because we don't know week to week what our allotment will be. And it sounds like all of us are doing everything that we can to get people vaccinated as soon as possible. And so it's very hard to have to say, I know you have to be patient, but that's the reality, unfortunately, as we aren't getting as many as we could give.
Well, that's good to know. When the vaccine ramps up, you guys are all ready to give out more. You have the capacity to do it. You have the refrigerators, you have the staff. So I want to thank you on behalf of all of the Chamber's partners, KV COG, Central Maine Growth Council, Health on Youth and Community Center, KV Connect. We appreciate your time. We know you're getting pulled in 100 different directions right now. And we appreciate all you are doing for our community to get our citizens and our workforce back up and fully functioning and healthy. I mentioned it before, I am proud of the healthcare facilities we have in our region and the love and care that you show for the community, each and every one of you. Just a reminder, beware of scams. Don't give out your social security number. Don't give out your credit card information. With that, I will say thank you, and everybody be safe and have a great day.
Thank you.
Thank you all.
Take care.